use of GLP1 agonist in reproductive medicine, and I've been using it quite commonly in women suffering from polycystic ovaries and obesity, where I make a combination of liraglutide and metformin, that is Victoza injections, or semaglutide tablets, which are commonly available in India, with metformin or semaglutide tablets alone. So let's understand a very few things about them. Most important is the what is the dosage. When I'm using Victoza injections, I generally start with 0.6 milligram a day and can go up to about 1.2 milligram a day. I just give a very short therapy for 2 to 3 months. There always moderate caloric restriction is done. So I tell them to restrict the calories to about 1600 to 1800. There could be some side effects like intestinal symptoms, intestinal hurry, and those effects could be there. When it comes to semaglutide, a 3 milligram tablets is available. So I generally tell them to take it in the morning on empty stomach at 6 a.m. with 120 ml of water, and after taking the tablet for 1 hour, that person is not supposed to have anything. After about 10 days of giving 3 milligrams, I increase the dose of, this is the name of the drug, it's Rybelsus. I increase it to about 7 milligram, rarely gone to 14. But I'm quite happy with using 3 and 7, and the desired effects of loss of appetite is quite nice, and the weight definitely comes down. What could be the side effects? Semaglutide, I have not come across major side effects, but the literature for the Victoza, that is liraglutide, it is definitely no for patients who are having chronic renal diseases. A thyroid cancer association was thought about, but it was in the meta-analysis which have been published after so much of use, they have not found out any great association with thyroid malignancies. Pancreatitis. The incidence of pancreatitis is 0.027 in 100 patient years, so it's pretty rare. But you can still, when you put on Victoza, you can just do an amylase level now and then to find out if it has gone up. There are about different mechanisms in which GLP-1 can be making a difference to us. One is GLP-1 agonist, they cause macrophage inflammatory cytokine secretion is decreased, the interleukin 1 beta, interleukin 6, TNF beta, they all decrease. So inflammatory markers come down. These patients who have obesity, their taste buds are differently designed. Because of obesity, the taste buds need a satisfaction of carbohydrates, so sugar, at a higher sugar level. So let's say you have a small amount of sugar, a normal man or a lady will say, well, it's too sweet, but they need a higher sweetness, a higher sugar amount to say that it is too sweet. So that also is altered by GLP agonists, and the taste bud sensitivity could be altered, and that's where it will make a difference to the intake of the client as well. Eating behavior changes because of that. There is delayed gastric emptying that slows the glucose absorption. It also stimulates insulin release from pancreas. So I've been commonly using GLP-1 agonists in women who are suffering from obesity or deciding to go for IVF and infertility treatments, because I feel after all, you need a double-digit weight reduction. A single-digit weight reduction doesn't give much results, and aided pharmacotherapy, aided weight reduction programs do make a difference. Sadly, both these things are a bit expensive, but for somebody who's determined to do weight reduction and getting a pregnancy naturally, I think this will definitely